you the host. Okay, thank you, I appreciate it. All right, so our next exciting product update is our CMR on-demand task. This is now available, or will be available by tomorrow, for our beta group pharmacies. What we've done here is we have enabled, we're sort of reverse engineering the CMR process, and we have enabled a task that will produce Medicare standard documentation in just a few quick clicks for our participating pharmacies. Based on the research that we did, we found that a lot of pharmacies are utilizing a worksheet tool of some kind that helps kind of guide them through the encounter. So at this time, we would suggest that you continue to utilize that sort of worksheet workflow. And as you are documenting the CMR encounter, you can log any changes that are made, interventions that are performed, drug therapy problems that are identified on the health record in DocStation. So the idea would be to, similar to how we've coached through the e-care plan workflow, document everything on the encounter, get that all up to date first, and then generate this on-demand task. What the task will allow you to do then is just quickly review the med list, make sure everything's up to date, identify how you communicated with the patient, whether that was by phone call, in person, various other ways, and then to create that formatted action plan. And then once you click continue for the task, it brings you to what you're seeing now in the screen recording here, the additional reporting requirements modal, where we have compiled a list of things that are required for those Medicare documents that may be missing, either from a medication record or from various places on the patient profile. So you can very quickly fill those out. And then what is produced after you've sort of washed out all the red on that modal there is the Medicare standard documentation. And so what we've done then is we will pull that information from both the formatted action plan that you mentioned in the task, as well as the various other points of the health record that were updated to produce that Medicare standard documentation. And then once you click continue there, you can see you scroll down to the bottom of the completed task and you'll see those attachments there. From here, then you can just print those out. Again, they contain all of the Medicare standard language. They're formatted according to those requirements. You can print them out and either mail them to your patients or present them at that time. E-care plan is still included in there. The added benefit we have here for this task for North Dakota Medicaid pharmacies is that this will also produce the additional documents that are required for North Dakota MTM in their standardized format as well. So we're definitely looking forward to getting some more testing available on this. Again, it's available to our beta group pharmacies. So if you are in that group, please give this a try. We'll be checking back in another couple of weeks to see what usage is happening. And then as you're utilizing it, of course, reach out to us on chat on the platform there so we can know that it's working well, see what improvements you think need to be made, and so on and so forth. Now, as all of you know, DocStation's MO is to make workflow as easy and streamlined as possible for the pharmacist. This is what we would consider sort of step one. So again, starting at the back end of the CMR process, getting those documents available for you, that's where we're starting. As we kind of reverse into the process overall, we want to take steps to simplify the note-taking process and the updating process, and also provide you that workflow document and all of these things. And for those pharmacies who are credentialed and participating in the programs where we get a claims integration, will also manage that eligibility check for you as well and be able to flag automatically for you patients who are eligible for these CMRs in those programs. So we're kind of building a stepwise approach to offer that sort of streamlined experience overall for you. So we're really excited to make that available again to our beta group pharmacies. If you're not in that group and want to have early access to this feature, just let us know. And then tagging along with that, we are also in the very early stages of building a medical billing platform within DocStation. Right now, we're honing in very specifically on the CMR process. Another piece of information that we found out through many pharmacy interviews is that especially in the Medicaid space, it is not easy to bill for the work that you're providing in the CMRs. Sometimes there are various portals, more paperwork, just additional work that you have to do to even identify an eligible patient. So we're attempting to simplify all of that, again, sort of starting from the back end and moving towards the front. So for a very select and exclusive group of North Dakota pharmacies, we are currently testing our CMR billing process within DocStation. So the goal here is that you'd be able to generate a claim for a CMR encounter within just a few quick clicks. So if you are interested in joining this exclusive group, again, please let us know. As we iron out the final details really over the next couple of weeks, this feature will become very quickly scalable across other programs, other Medicaid programs specifically across our network. So if you're not in North Dakota but are interested in this awesome feature, reach out and let us know, especially if you want to help with testing, and we'll make sure to ensure that those programs are prioritized on our lists essentially. For pharmacies who are testing as sort of an incentive bonus, we would like to provide the benefit and reward of some billing credits once our feature is fully launched, or a gift card of your choice, whatever makes the most sense for you. But we're definitely thankful for the time that you spend with us and the feedback that we get. So we're appreciative of that help. And then I think the final product update I wanted to talk about today is our IIS updates. You guys have been hearing us talk about the immunization registry, gateway registry integration for like, I don't know, 2 years at this point. It's been a long time coming. And as we have all noticed, the IZ Gateway was no exception to the delays of COVID, and now especially the COVID vaccine. But we're really excited to announce that we are expanding our registry integration with both MIC and NDIIS. I feel like we've been in testing for like 100 years, but now we've just recently added about 60 pharmacy locations across both states. We did have about, I think, 40 in Minnesota prior to this next integration. But we're very excited to add a big group of pharmacies here. The benefit that the Immunization Gateway Registry adds to you is primarily in real-time updates to immunizations in the patient health record. So what this will look like is in the health record, in the immunization section that's all the way towards the bottom, you'll see real-time updates there for every time you open the patient profile, and then 24 hours thereafter. And it will also provide updates to the immunization screening task. So where your former workflow may have been to open that task, log into the registry, see what immunizations are there, copy them over to DocStation. Now that information from the registry will feed automatically into that task. The secondary benefit that will allow you to document administered vaccines in DocStation instead of then going to the registry as well. So as we continue to chip away at these integrations, we're really trying to reduce the number of platforms you have to log into on a regular basis. This is one more added benefit where if you're working with a patient in DocStation, if you've already done an immunization screening, now you're providing that missing immunization that they had, you can document that it was provided in DocStation, and that information gets fed back to the registry automatically. So we're really excited for that. Those 60 pharmacy locations we just added will shortly be receiving some information, some training to make sure that you understand how that works. We've got Help Center articles, of course, that cover all of these features. But if you are too antsy and don't want to wait for that communication, by all means, you can verify your integration registry status by checking the data exchange tab on your location tab under settings. So what you'll see here is this picture of, as we've got listed here. When you hover over the settings cog, you can get to locations and then data exchange, and you'll see immunization registry is live for you. If you get over to this page and you don't see that immunization is live for you in either North Dakota or Minnesota, and you really want that, please send us a little chat. We'll make sure that we can prioritize your onboarding for the next expansion. All right, so those are all of our exciting product updates. At this time, I am thrilled to invite to the stage our partners from PatchRx. As you guys know, DocStation has always made a point to find innovative partners in the marketplace, and we are always looking for new ways to support our pharmacy community with new tech. And so PatchRx came to us as a good friend, another amazing innovator in the healthcare space, and someone that we're really looking forward to solidifying a partnership with. But their mission and vision are so closely aligned with us, and they have a really cool product that we wanted to take a few minutes to let them present their ideas on today's call. So with that, I would love to turn it over to, I think I've got Gavin and Kevin on the line. So welcome, guys. Thanks for coming.
Great. Thank you so much, Aubrey, for that warm introduction. And thank you, everyone, for giving us your attention for some time. We're really excited to be talking to DocStation's great user base, because I know that you all are really innovative individuals within this space, which is always exciting to start conversations with really innovative pharmacies. But to tell you a little bit about myself, I'm Gavin Buchanan. I'm the CEO and co-founder of PatchRx. And to tell you a little bit more about my background, I'm not a pharmacist, but I am an engineer by training. I actually came to the US from Mexico when I was 4 or 5 years old and grew up in the foster care system all around Texas. And what that did is give me a lot of experience with adversity early on that I then attributed to my reasoning for becoming an engineer to solve problems big and small as I came across them. And it was actually while I was working at NASA as an engineer when I got a call telling me that my adoptive grandfather had passed away suddenly, which came as a shock because he was still a really healthy and active individual, would run 5Ks and still preached every other Sunday. But I found out that earlier that day, he hadn't taken his heart medication as prescribed, went out for a walk, and his heart failed. And by the time he was found, it was too late. And it was losing him in a completely preventable way without my or my family's ability to intervene that revealed what seemed to be a critical failing in the healthcare system and got me thinking about the issue of medication non-adherence. And that critical failing seemed to be that we put all this time to develop new and novel medications, and then doctors and pharmacists go through all the training that they do to be able to accurately prescribe and diagnose and then dispense the correct medication to an individual. And yet at the patient level, we don't provide very many ways for patients to actually manage their medication, track their doses, and almost nothing in the way of a real-time health intervention in the case that they either miss their dose or if they overdose. And so I got together with my co-founder, Andrew, who's also on this call, and we had met in undergrad. He's got complementary skills in software development, but has personal experience with medication non-adherence through his battle with type 2 appendiceal cancer, which has given him that firsthand experience with taking several specialty medications and knowing what it's like to try to balance that with just living a regular active lifestyle and working and studying full time. And so we put together our experiences as well as our skill sets. And our goal was to fundamentally improve the patient experience with taking a prescription medication and build the best patient engagement tool on the market for pharmacies. So we started development a little over a year ago, and we talked with hundreds of pharmacies really across the country in all sorts of settings: compounding, specialty, retail, independent, locally owned pharmacies as well, and trying to figure out what the pain points were from both patients taking prescription medications and why there's such a lack in adherence, and also from the pharmacist perspective about what it would take for them to adopt a smart adherence solution. And what we found out pretty early on was that for pharmacies, in order to adopt a smart adherence solution, they needed a few things. From a device side, they wanted something that was universally fit and could fit in any pill bottle right away directly. Also had to be extremely cheap and also had to be really easy to integrate. And what we found was that there really wasn't anything on the market that pharmacists could easily put into their pill bottles that would differentiate their product and also fit and make reason for their margins. So we created the PatchRx device, which is the first component of our solution, which I'm showing up on my screen. But it's a small nickel-sized device that takes just 5 seconds to stick and add on to any size pill bottle. And I'll show you a 12-dram bottle from Walgreens that our device just fits nicely right therein. So it takes 5 seconds to stick and add on. And once it's there, tracks every time the patient takes their medication and relays that to our software. And our software really comes in 2 major components, and they're both on the screen: a mobile app, which is optimized for patient engagement, and a web app that allows for the pharmacy or care provider to see all of that individualized adherence data in real time and be able to make meaningful real-time health interventions the same hour or same day that they miss their dose or overdose. And so Aubrey, if you could hit or go to the next slide, or Simon, whoever's. So like I said, our fundamental goal is to improve the patient experience and increase patient engagement and retention. And so on the mobile app, we do this by reminding patients when to take their medication, allowing them to track and manage their medications through the mobile app, but also providing rewards with financial incentives for them taking their medications on time and refilling their medications on time. So the way that works is that they can select your pharmacy if you're a pharmacy partner with us. We build out rewards programs with your pharmacy in order to improve patient engagement and actually getting them to come back into the store and spending money on the retail side. We actually modeled it after CVS's Extra Care program, which they launched in 2019, where a patient can spend $5 to be part of their Extra Care program, and they get all these benefits on wellness programs, but they also get $10 in free retail sales every month. And you would think they're spending $5, but getting $10 back, they should be losing money. But CVS has actually reported a huge improvement in retail sales and patient engagement and retention on their retail side by actually incentivizing people to come spend money and get familiar with spending money at their local pharmacy. And we wanted to provide that same benefit to our local independent community pharmacies. But then we've also got some patient engagement tools on the mobile app that allows them to add their family and friends into their care circle and into their medication journey, who will be able to see how they're taking their medications and get notifications when the patient has missed a dose and be that first line of defense in the battle against non-adherence. And also to provide that social aspect, which is really important for people to have those around them be involved in their healthcare journey. We also have some other gamification features. We have a virtual buddy that's kind of an AI chatbot that can talk directly with the patient. We have some daily survey questionnaires that allow for the patient to check in and see how they're feeling on a day-to-day basis, and provide yet another tool for our pharmacies and our care providers to have that extra level of engagement and data about how their patients are actually doing on a day-to-day basis. And then the next component, I'll let actually Kevin jump in and talk a little bit about, but Simon, if you could click to the next slide, is on the actual web app.
Hey, fantastic. Well, thank you guys so much for letting me come here. I'm Kevin Walker. I just joined the team as their Chief Strategy Officer recently, and super excited, coming from a pharmacy director role in the healthcare space, particularly critical access hospital, and actually having a retail pharmacy inside of there for our employees. So getting to see some of the things that were going on at PatchRx and now getting familiar with DocStation, it's wonderful to see a group of pharmacists and pharmacy owners coming together to leverage a lot of those clinical skill sets and hopefully find a new revenue stream, not only to benefit their pharmacies, but the patient population they serve. And you just see that altruistic thinking way too often in the pharmacy setting without it being rewarded and without it being streamlined. And it's really exciting to see a forward-facing program like DocStation allow that to happen. So we hope to do the exact same thing on a lot of our frontiers, especially through the web app. So the web app in particular, we want to be able to drive meaningful and actionable data right back to you. So when you're pulling medication information from your individual patients, how they're taking their medications, when those timestamps are coming about, we've all seen kind of the iterations inside of the hospital settings and some of the large ambulatory settings when we're pulling metrics from nursing staff members. So we're seeing the exact same data, real live data coming from patients. And now you can take those and use those in programs that can hopefully leverage those not only to bill for, but also to impact overall patient outcomes, right? And we talk about adherence, we talk about data, but unfortunately something lost is outcomes. And we really wanted this portion of the platform to be able to be leveraged by our pharmacy partners to look at the things that really matter. If it's star ratings or HEDIS, then great. If it's an individual that's not taking their levothyroxine separated from their calcium far enough, then even better. Where there's just some real clinical applications I'm excited about. And Simon or Aubrey, if you could switch it to the last slide, would be great. So these are just some different advantages. The top kind of section was from just an overall study that was looking at adherence platforms, and the bottom two sections are what we've seen in some of our research and data initially. So we're working with a couple different universities on some individual clinical trials and seeing these types of adherence rates come out from them, always adding different features and performance elements that we're A/B testing to see how well they're working in incentivizing and motivating patients' individual behaviors. But me being a pharmacist, my real bias is obviously on the dashboard back end. I feel like we can incentivize patients to do the right things, but what really matters is sometimes the drug regimen is wrong altogether, and giving pharmacists those tools like what DocStation is doing and some of the data analytics that we're giving will allow those pharmacists to make those deep prescribing decisions or integrative healthcare decisions that really impact overall care. So those are some of the pieces we had. The statistics pulled from those previous studies, are just really looking at, adding a very simple alarm clock system right into place. And obviously we feel like the pieces that Gavin and Andrew kind of spent a lot of time and money and effort to research and look into, with the gamification elements, the rewarding pieces, and then the collaboration and connectivity with their healthcare providers. That's what's going to bring ours to another level and hopefully be much more helpful to you guys as end users to help your patients. But that's it for me, and I wanted to wrap it up and give it back to Aubrey.
Well, really appreciate the input there, Gavin and Ken. We'd love to hear your stories. And Andrew, thanks so much for joining us. Does anybody have any questions of the PatchRx team at all? And I know, Simon, you're keeping an eye on a chat box there. Is there anything for the PatchRx team?
Nothing's come in yet.
All right, give folks a moment to find their mute button if anybody's interested in asking some questions. Quiet group today. All right, that's okay. Well, as we've stated, PatchRx is a great friend of DocStation's. We don't have anything officially in place in terms of a partnership or integration yet, but it is something that is on the horizon for us that we're working towards. Part of the opportunity for inviting them to the call today is so that you can get to know what additional innovation is out there. And these guys have a really great pilot program that they're working on. And so if you are interested in working with this team, please feel free to reach out to them directly. It does not need to be by way of DocStation. We really want you to be able to take advantage of the really cool products that are happening here, the advancements that they're making in this area. And we do know that a number of our overlapping network pharmacies are working in these specific pilots, and we're finding ways that DocStation can help support the work that they're doing with PatchRx patients as well. So again, if you are interested in learning a little bit more about them, please feel free to reach out. All right, so we'll go ahead and round out our meeting today with our general discussion. This is a time where we just like to open the floor and find out how things are going. I've got a few prompting questions up here about how DocStation is supporting your clinical practice or what we could do better, and maybe perhaps what other programs or features you'd like to see in DocStation. If anybody has anything they'd like to share, please do so at this time. I don't have it on the board, but also really interested to know just how's it going? I feel like it's been a while, and since we talked last, a lot of you have engaged in federal pharmacy partner programs with the COVID-19 rollout. Some of you have been able to do it directly depending on your state regulations. How are things going? Does anybody have any comments they would like to share for the benefit of the community? All right, that's all good. I'm fine with silence. I just got to take a break from my own talking every once in a while, All right, very good. Well, the last announcement we'd like to make for the DocStation community is the Independent Pharmacy Collective group now on Facebook. We're very excited to have a great conversation happening over there, and the membership there has really ramped up in the last couple of weeks. So if you are a Facebook member, please jump on over there and grab an invite. This, of course, is a link here. So as I send out the follow-up email to this meeting, you'll have this in the slides and be able to click on that. But the Independent Pharmacy Collective is just a great place for professionals to talk about innovative ideas, talk about things that are happening around value-based care, best practices as well, and especially how DocStation is helping you or what we can do to improve. So invite your pharmacy colleagues as well to that Independent Pharmacy Collective group. And finally, again, we do know pharmacy is a small world. If you have other colleagues, friends in pharmacy across the nation who could benefit from a platform like DocStation, even if there are not programs yet, we're always looking for new partners. Please send them our way at docstation.co. Again, very excited to have all of you. Sorry, I didn't have any DocStation musician music to feature this month. I know I usually have something, but our musicians have been grounded for a few months, as have the rest of us. So hopefully next time we'll have some good chill vibes for you to offer there and be able to feature more of the talent that's happening over here at DocStation. But thank you again so much for joining us. PatchRx guys, thanks so much for being here. Really appreciate it. And we'll see you all around the platform. Have a great afternoon.
Thanks, everyone.
Take care,
Thank
guys.
you.